You're listening to Conferences Online Allergy from Children's Mercy Hospital in Kansas City, Missouri. Today is July 29th, 2024. We are doing our orientation series, and today we will be discussing artificial or augmented intelligence in healthcare. This is presented by Dr. J. Portnoy, a professor of pediatrics in the Division of Allergy, Immunology, Pulmonary, and Sleep Medicine at Children's Mercy Hospital in Kansas City, Missouri.
Okay, so I'm going to talk about artificial intelligence in healthcare. This is a topic that I couldn't have given 2 years ago because it didn't exist. Now it's real and it's here. The AMA actually prefers that we call it augmented intelligence. I'll explain why in just a moment, but I still like to call it artificial intelligence in healthcare, or AI. And I'm not a robot, but I actually am a human presenter with no conflicts to disclose, though I might find it hard to prove that I'm a human, given the fact that the difference between humans and robots are kind of getting blurred. But just take my word for it. These are some objectives that I had for our presentation. And I'd like to introduce the presentation by just telling you about an experience that I had in December of 2023. At that time, the ACGME, they're the folks who accredit training programs in healthcare, they held a workshop in Chicago to discuss the future curriculum for training future physicians. And I should actually stress that these are actually current today's physicians, future curriculum for training today's physicians, because after all, today, physicians being trained are going to be practicing in the future, although you also have to be able to practice today. The issue was, how do we prepare today's trainees to practice in 2050? I thought that was a pretty mind-boggling exercise. How do we have to think about what 2050 is? Unfortunately, we don't know what practice in 2050 will look like. It could look in any of a variety of ways. Because of that, curricula for each of 4 scenarios were proposed. So the ACGME gave us 4 scenarios for what healthcare would look like in 2050 and divided us up into 4 groups, and we came up with a curriculum to train fellows to practice under each of those 4 scenarios. And then they looked for common themes that could be used to train fellows that would prepare them for any scenario. One thing that was common for all of the scenarios was that artificial intelligence would play a major role, and I think we all understand that that has to be true. So physicians in training today must be trained to use artificial intelligence. So what is artificial intelligence, or augmented intelligence as the AMA prefers? The AMA prefers augmented intelligence because it combines human expertise with machine learning to enhance decision-making in healthcare. It's basically a partnership between humans and machines. This collaboration augments provides augmented intelligence. It recognizes that humans and machines have complementary strengths. It aims to amplify human abilities by providing insights and recommendations from the artificial intelligence. This is distinct from traditional AI, which I think is just AI. I don't know that it's traditional, but basically AI is used to replace human decision making. I think the AMA is threatened by this concept of doctors being replaced by robots. So they want to emphasize that it's a collaboration between the two. And I think initially that's how it will be. But if you think about 2050 and what that will be like, my guess is there will be a lot more AI and a lot less human, but I could be wrong. There are a number of different platforms of artificial intelligence available, and if you want to get involved with playing around with artificial intelligence, you might look into some of these. These are generally available to the public. Some of them you've already run into, and some of you may already be very experienced in working with artificial intelligence. Probably the most commonly used one is this one called ChatGPT. It's actually freely available. You don't have to pay to use it. GPT 4.0 is available for free, although there is a paid subscription version of it that would allow you to do more things. But you can do an awful lot with the free version. It's extremely versatile. You can talk to it. I'll show you in a minute. It's got a lot of different capabilities, and it's very easy to use. Another one is called Perplexity AI. Perplexity is interesting because it is basically used for searching. If you want to do a literature search, usually you would go to PubMed and type in keywords. I'm not good with keywords, so Perplexity can search PubMed for you, and you just tell it what problem or question you have, and then it'll do the keyword stuff for you and give you a list of references that answer the question that you're looking for. Microsoft Copilot is Microsoft's version. It's available with anybody who has an Office 365 license. This comes along with it. Adobe Acrobat AI Assistant comes with Adobe Acrobat. So if you read PDF files, for example, Acrobat Assistant, AI Assistant, it comes along with it. It's a paid subscription. It will read a few pages per day, but if you want to read a lot of them, you have to subscribe to it. And then a lesser used one is called Jasper AI. It's designed to help you write books and manuscripts. If you want to write a book, use Jasper AI, and it will help you outline the book, create the characters, and actually write the text of the book. If you ever wanted to write that great American novel, Jasper AI might be the thing for you. This is ChatGPT, and I'd actually like to introduce you to ChatGPT right now. So here we are. Hello, ChatGPT. This is Dr. Portnoy. I'm giving a lecture to a group of allergy fellows, and I'm talking about your capabilities with ChatGPT. Would you like to say hi to the allergy fellows and maybe briefly introduce yourself?
All right, sounds good. What would you like to use as an example?
No, it didn't answer my question. Let me try that again. Good morning, ChatGPT. I'm giving a lecture to a group of allergy fellows on artificial intelligence. Would you like to introduce yourself briefly and say hi to these fellows?
Good morning, everyone. I'm ChatGPT, an AI language model created by OpenAI. I'm here to assist Doctor. I'm excited to be a part of this session and look forward to contributing to your learning about AI in the field of allergy and immunology.
So you can see that sometimes you have to try a little bit harder, but you can actually carry on a conversation with ChatGPT. This is the one that's most commonly used. This is the screen that you see if you download the app on your iPad or iPhone. If you use a website, then it looks a little bit different. I find the iPad and iPhone to be the most useful interface. Here are some things that are structured in it. You'll notice that it's a big blank screen. On the lower part, on the bottom on the left, there's a camera. What you can do is take a picture, and then that picture is something that ChatGPT can look at and comment about. You can also upload an image from your photo library, or if there's a file you wanted to read, if you wanted to read a PDF, for example, and then summarize it for you, because sometimes it's good to do that instead of having to read the article yourself, you can input the document by clicking on this. You can talk to AI, or you can type your message. If you type your message, you can type a question or comment or whatever it is you want to do to interact with ChatGPT. Another thing you can do is click the little microphone icon, and when you do that, you can talk to it, but the output will be in text form. What I was doing is I was clicking on the little headphone model, and when you click on that, then ChatGPT will listen to you, and then it will respond to you, and you can carry on a verbal conversation with ChatGPT. It also offers some suggestions for things you can do. So if you want to download ChatGPT, it's an app. You can go to the App Store, an Android store or the Apple Store, and look for ChatGPT. There will be a whole bunch of lookalikes. You want to get the one that's sponsored by OpenAI, not by any of the others. If you look for the OpenAI, it'll have this little symbol right here in the middle. Download it, I think you'll have to sign in, and you'll have to give it your email address and create a password, but you don't have to subscribe to it. It's a free service. When you subscribe to it, you actually get a little bit more functionality. You can choose the version of ChatGPT on the very top. Right now I'm running GPT 4.0, which stands for Omni. You could also run just regular GPT 4, which has slightly less capabilities. And there's also a 4.0 mini, which is a smaller model, but it runs faster, they say. So there's some advantage if you want a quick responding model. I usually just run 4.0. It gives the best and most complete answers to questions you might ask. There are a number of other GPT models on the left side that you can play with. Data analyst is particularly interesting because if you drop a database, a spreadsheet, like Excel spreadsheet in there of your data from a study you did, it will immediately start analyzing the data, print out descriptive statistics, do analyses. You can generate ROC curves. It will do regression analysis. It'll basically do whatever you want it to do. It's just like talking to a statistician, except that the results of your request happen immediately, and it will suggest things to do. If you want to develop a PowerPoint presentation, use Presentation and Slides GPT. Tell it what you want to talk about, and it will outline your PowerPoints and even develop some example slides that you can use. DALL-E is a graphics module. You basically describe what you want the picture to look like, and then DALL-E will generate that picture. CV Writer, if you're in the process of writing your CV, it will just tell it information about your biography, and then it will generate a CV that is basically structured however you want it. And there are literally dozens of these GPTs you can explore, and it's just absolutely fascinating. I've actually had a number of sessions where I've discussed various issues with ChatGPT, and it actually stores all of those sessions. So the output and the results of it are stored in this journal right here by date. So you can go back and look up what you talked about before, and you can even continue a conversation that you've had in the past, and it'll just pick up where you left off. So this is the way the ChatGPT looks. If you want to get involved with this, I would encourage you to download it, start using it and play around with it, ask it some questions, and get comfortable with it. This is what I mean by fellows learning how to use artificial intelligence. If you start using this, you will find it to be an indispensable tool. Another tool is AI Assistant. This is Adobe Acrobat, and this is Adobe's artificial intelligence. What's nice about this is if you use Adobe Acrobat Reader, which is what this is, I had it open a PDF of a JAMA article from the medical literature. And as soon as you do that, AI Assistant will help you summarize the important points from this document, or it will just tell you what the document's all about. It'll basically read the document and then summarize it for you, so that you can decide whether you want to actually read it or not. I find that a lot of scientific journal articles are a little bit tedious to read, and it's easier for me if I had the ChatGPT or AI Assistant summarize it. Here it's built right into the PDF reader, so you can get this assistant reading. If you really want to keep asking questions about the document, I think there's a subscription fee for it, but for free you can just get a brief summary and have it answer these particular questions. Another GPT is Copilot. Copilot is a GPT that you get with Microsoft Office and Office 365. If you run Microsoft Edge, which is their web browser, on the left-hand side, there's a little icon. It looks like this right here. And if you click on that, Copilot opens up, and you can use that. You can interact with it as an artificial intelligence. I took the liberty of running ChatGPT in Microsoft Edge and then running Copilot next to it. So we have two AIs sitting next to each other. You could actually type the response from one into the other and have them talk to each other. And I've actually run two versions of ChatGPT and had them carry on a conversation where one talks and then the other listens and then talks and then listens, and they go back and forth. And it's particularly fun if you ask it to debate some kind of controversial political controversy. Tell one to be the Republican and the other to be the Democrat, and then just sit back and watch them argue with each other. It's a lot of fun to do. Okay, so let me go to the next one. Okay, so those are some of the GPTs that you can use. You're already using Copilot. You can already use AI Assistant from Adobe. And ChatGPT is the one that you really should download and start using. You should have a relationship with your ChatGPT. Give it a name, tell it what name to call you, and it will start calling you by that name. But what is GPT? We keep hearing about this. What does the GPT stand for? Well, G stands for generative, P stands for pre-trained, and T stands for transformer. The generative part means that this GPT will generate new content based on information that it was trained on. And this content isn't necessarily a rehashing of something it's already read. It will create a new variations on the content, and sometimes totally novel content. You can ask it to write poems. It will generate a poem that has never been written before. So it is truly generative. The P stands for pre-trained. In other words, it has undergone extensive training on a large corpus of text data, and it's been fine-tuned or used for specific tasks. The pre-training basically uses the entire content of the internet, and more recently, it's also using the content of interactions between people in ChatGPT. It's also using interactions that are generated on various platforms. So the pre-training is going to become more and more extensive as newer versions of GPT are developed. The T stands for transformer. This is the neural network architecture that is used to transform the query, the input information that the query that you ask. This is what transforms that into the output. So the T is the transformer, which is the heart of the GPT model. I mentioned neural network. This is what a neural network looks like. Neural networks you've seen look like this. It has an input layer in orange. This is the input, the information you put into it, the query that you might ask it. And then there are a whole bunch of hidden layers. And then there's an output layer that has the output of the results of what you asked for. The hidden layers you have no control over. They're just hidden. But the input is what you give it, and the output is what comes out. Behind the scenes, the way this works is each of these nodes or neurons, if you want to call them that, is associated with a different weight. And so here there are 3 nodes. This one, X1, feeds to Y1, Y2, and Y3. So there's a weight that goes to each of these different ones from X1, and the same from X2 and X3. Every neuron feeds to every other neuron in the hidden layer, and then that also transfers to another one. So when we talk about the parameters of this neural network, we're talking about each of the weights. There's 3 weights from each neuron, so there's 9 weights altogether going to Y. Y1, Y2, and Y3. And then there's a bias that occurs afterwards that increases or decreases the value. So these weights are multiplied together by the original value in the neuron. They're added together, and then they go through an activation formula. It's usually softmax is what it's called. And then there's a bias that's added to it, and then that is the weight for the next set of neurons. And so it goes on and on and on. This is a simple one. Just think about this larger one right here and how many weights and how many biases there are that are involved in this network. And this is a fairly small network compared to the billions and trillions of neurons that are in the large language models that we were talking about with artificial intelligence. Each of these weights and biases has to be tweaked so that the input results in the desired output. And doing that requires the training. The training is the system of tweaking all of these weights and biases so that they give you the output that you want. And this tweaking is done by use of a variety of techniques like backpropagation and loss functions and so on that if you're interested, you can go online and learn about, but we're not going to talk about those today. So how does GPT actually generate new text? Well, if you give it an input like to date the cleverest thinker of all time was blank, you want to know what the next word is, the first thing you have to do is to tokenize the input. Initially, the tokenization was just by words, but sometimes it's better to tokenize it by syllables. So here, cleverest is actually broken into 3 separate tokens. And then punctuation has its own tokens and spaces and periods and all of that stuff. Each token is then encoded. By encoded, they're associated with a 1 by n matrix, where n is the number of different parameters that are associated with this token. And this is what defines the semantics of what that word actually means. And so this encoding is part of the training that has occurred. By doing it this way, then you can have these matrices, these vectors interact with each other in a way that gives you the output. The token embedding matrix is actually huge. There's over 50,000 different tokens, and this is 2056. 1 by 2056 matrix right here. So each of these vectors defines a component of the semantics of what the word actually means. What does that mean? Well, this is a thing called the attention mechanism. It basically looks at the semantics of how different words relate to each other. So for example, we're looking in 3 space. This would actually be n-dimensional space, which we can't visualize. But the question is, aunt and uncle, how are they related to each other? And is it the same as woman to man? Which it should be, because aunt is a female person and an uncle is a man. So if we have a matrix for man that ends here and for woman that ends here, the difference between these two defines the difference between man and woman. So then if we look at the matrix for uncle, the difference between uncle and aunt should be the same distance as between man and woman, because the only difference between these two is the gender of the person, and that's in fact the way it works. And so by encoding all of these different words into this matrix, you can get words that have similar meanings will end up in the same location, those that have different meanings in different locations, and the relationship that the words have with each other, the difference between the two matrices, also can be have meaning. This is the attention mechanism. So the tokens go into this huge matrix, and then they interact with each other. They are decoding, they generate. The question is, how do we generate the next token? And the way we do this is we have these interact with each other, then the output is fed through a neural network, and then they interact with each other again, and then there's another neural network. And it's a long sequence of analyses until the output comes out, which is the sampling of the decoding output. The decoding output basically has all of the different tokens that result in this output matrix, and there's a probability associated with each one. So each one has a different probability of being the next token in this sentence, and then the sampling basically decides which of these to put in there, and usually it's the one with the highest probability, but there is a randomization feature that may allow some lower probability values to go in there too. That creates novelty and allows it to be a little bit more varied in its output. And then finally, decode tokenization is taking these numerical vectors and converting them back into text so that they can be output for you to read. That's a very brief overview of how it works. It's not particularly accurate. You would need to get a book and really study it to understand it. We know that GPT has undergone a number of releases. The first one, GPT-1, was released in 2018. That's only 6 years ago, if you think about it. It had 117 million parameters. Those are all those weights and biases in the neural networks. These are the decoding layers, the context token. So the context token size was 511 tokens. That's the number of tokens that can be input and associated with each other to generate an output. The hidden layers 768 hidden layers in the neural network, and the batch size is the size of the information that was processed at any given time. So GPT-1 had these parameters, and when you gave it an input phrase or token, series of tokens, it would output something that initially sounded somewhat coherent, but very quickly turned into incoherence. It didn't last very long. So the first few output tokens made sense, and then it stopped making as much sense because there just wasn't enough information in here to get a lengthy output generation. GPT-2 had an order of magnitude larger number of parameters, and everything was increased in size. And that gave a much more coherent response to input queries. The response could go on for maybe a paragraph or two before it would devolve into incoherence. So again, this was better, but it still didn't get to the goal. The real goal occurred in 2020 when GPT-3 came out with 175 billion parameters. This ultimately allowed 3.2 million tokens to be input and analyzed at the same time. So the context of the entire corpus of information that was being processed could be understood at the same time simultaneously, so understand everything. Strange thing happened when GPT-3 was turned on. You put in a query, and instead of getting an expected output that eventually lapsed into incoherence, it gave what appeared to be an intelligent, understandable response that could go on almost indefinitely. And it seemed to be creating new information, and it was like an emergent property of intelligence. This was totally unexpected by the computer scientists, by the way. Nobody expected that when you increased the number of parameters, that suddenly it would turn on and become intelligent. But that seems to be what happened. This emergent property of what seems to be intelligence occurred with GPT-3. And when GPT 3.5 came out, this was even greater, and GPT-4, which is now, the word is not publicly available. GPT-4 is publicly available, but the information about it is not publicly available. It's estimated that there were more than 1 trillion parameters in GPT-4. And GPT-5 is currently being trained. It takes up to 9 months to train it. We don't know when it will be released, but there's indications that it may verge on the border of human intelligence and consciousness, whatever that is. So this is something to look at. Okay, well, what does this mean for allergists? Well, this is what contributes most to our burnout. Too many bureaucratic tasks, too many hours at work, lack of respect, insufficient compensation, and so on. But the bottom line is too many bureaucratic tasks. The work that we do is very bureaucratic. We'd like to take care of patients, and instead we spend all of our time doing dictations and documenting things and generating bills and coding and all of that stuff. And it's just a real pain in the neck, and most doctors really don't like to do that. This is where GPT can really shine. So one form of GPT that I'm very excited about is this thing called ambient AI. Here, just picture you and a patient are in an exam room, and the AI listens to your history and physical with the patient. It then generates the medical documentation for you to review. It listens to it, and then it generates the note. You can review it, and then you can even ask it to suggest diagnoses and treatment plans if you ask it to. And it can generate handouts for patients to take home. It does a lot of the work that you would have normally done for you. All you have to do is review and sign off on it. This is currently available. In fact, 18% of doctors work in facilities where ambient AI is already being used. And if you're not one of those 18, you soon will be. It's available from several independent vendors. If you go to the academy or college meeting, last year at the college meeting, I saw some vendors who were offering an ambient AI system where you put your cell phone in the room, talk to the patient, and when you're done, it writes the note for you. These are available today, and they do a pretty darn good job. Some of them are integrated into electronic medical records, such as Epic. So if they activate that and you have Epic, then you already have ambient AI. I think this is going to take a lot of the burden off of medical practice. Okay, Another thing that we do, and let me see if I can get ChatGPT. I asked ChatGPT these questions and then I wrote the output because it's not always possible to connect to ChatGPT. It depends on the network. But let me ask ChatGPT with a new version to in this question. This is a common question that comes up. Hi ChatGPT. The patient is diagnosed with seasonal asthma, mild persistent, well-controlled, seasonal allergic rhinitis, bilateral allergic conjunctivitis, and atopic dermatitis. Can you tell me what the ICD-10 codes are for these conditions?
Sure, here are the ICD-10 codes for those conditions. 1. Seasonal asthma, mild persistent, J45.30. 2. Well-controlled melanitis. This might need more specific context to determine the exact ICD-10 code, as melanitis isn't a standard term. Could you clarify or provide more details? Lateral allergic divide. This term is not standard. If you mean a specific type of...
So obviously the audio didn't understand what I said. There might have been a network glitch or something. Basically, when I asked it to get the ICD-10 codes for these conditions, it just spit out just like it was doing J45.3, J30.2, H10.45, L20.9, and it just spit those right out. So if you have coding people who are looking up all these ICD-10 codes for you, you don't have to do that anymore. GPT-4 will do that for you. Here's another one. Let me see if I can get it to work with this one. Hello, ChatGPT. I performed 20 prick skin tests, 5 intradermal allergy tests, and spirometry. What are the CPT codes for these procedures, and how many RVUs are they worth?
Certainly. Here are the CPT codes and RVUs for the procedures you performed. 1. Prick skin tests, percutaneous tests such as skin prick tests. CPT code 9504, RVUs approximately 0.31 per test. 2. Intradermal allergy tests. CPT code 9524 for each test, RVUs approximately 0.35 per test. 3. Spirometry. CPT code 9410, RVUs approximately 0.17 per test. The total RVUs would depend on the exact number of tests. For instance, for 20 prick skin tests and 5 intradermal tests. Prick skin tests, 20 tests at 0.31 RVUs will 6.2 RVUs. Intradermal tests, 5 tests at 0.35 RVUs, 7 spirometry, 1 test at 0.17 RVUs. Total RVUs will 6.2 plus 1.75 plus 0.17, 8.2 RVUs. These values can vary slightly based on the payer and updates to the fee schedule, so it's always a good idea to check the latest.
So as you can see, the results are a little bit different this time. So you really need to check and make sure that it's using accurate information. So you can't purely trust it. You have to check on it and make sure that it gets the right answer. Here's another one that I thought was particularly interesting. You can read skin tests. So here's an example. Let me have it do that. I'm going to input this skin test into ChatGPT right now. Okay, and then I'm going to ask it to read the skin test. Hello, ChatGPT. Please look at the image I just uploaded and then interpret the skin test in terms of millimeters of wheal and flare.
Based on the image provided, I can interpret the approximate sizes of wheal and flare for each allergen tested. Here is the interpretation. Histamine, positive control, appears to have a strong reaction with a wheal size of approximately 5 to 7 millimeters and a noticeable flare. Feather, moderate reaction with a wheal size of about 4 to 5 millimeters. Cat, strong reaction with a wheal size of around 5 to 6 millimeters. Dog, moderate reaction with a wheal size of approximately 4 to 5 millimeters. Horse, strong reaction with a wheal size of about 5 to 6 millimeters. Sheep wool, moderate reaction with a wheal size of approximately 4 to 5 millimeters. Plain pollen, Mild reaction with a wheel size of about 2 to 3 millimeters. Birch pollen. Strong reaction with a wheel size of around 5 to 6 millimeters. Grass pollen. Strong reaction with a wheel size of about 5 to 6 millimeters. Moderate reaction with a wheel size of approximately 4 to 5 millimeters. Alternaria mold. Mild reaction with a wheel size of about 2 to 3 millimeters. Negative control. No reaction, as expected. These interpretations are approximate and based on visual estimation from the image.
And it helps if you put a ruler in the image so that it can compare that to the size of it. I asked it to mix an extract for me. I gave it information about what extracts are available from the manufacturer. I told it what effective doses are for each extract, and then I told it that I wanted to make an extract. How do I do that? And it immediately started to show the calculations. So it did this calculation, and it did these calculations, and then finally it had a procedure so that somebody in the shot room, if you have an allergy shot extract generation room, would be able to just add these volumes of the extracts, combine them together, and then they would have the mixture that you need. So you could use this to do the math for the various extracts that you might be using. And then I asked it to provide a description of these rashes. So you can input this picture, and then I said, please describe these rashes. And you can see for the left arm, it said it was erythematous, redness, inflammation, excoriation. Basically, it described it the way a dermatologist would describe it. I'm not a dermatologist. My description would be a lot less medically accurate. It also made a diagnosis, acute eczema with signs of inflammation and scratching, and that's exactly what it is. The right arm is a little different. It shows lichenification, leathery texture, hyperpigmentation, and this is thickened hyperpigmented due to prolonged scratching, and is common in chronic eczema. So you can I can see taking a picture of a rash if I'm not sure what it is and asking ChatGPT what that rash is. I did that this morning with the patient, in fact, and it told me what the rash is and what to do about it. I wasn't sure what the rash was. So it doesn't always get it right, and sometimes you still need to consult with a dermatologist. We humans recognize rashes because we do pattern recognition. And if you haven't seen the rash before, you can't recognize the pattern, and looking it up in a textbook of dermatology rashes is a really hard thing to do. Dermatologists spend years just seeing lots and lots of rashes so that they've probably seen it before, and that's how they recognize it. So that's the difference. ChatGPT has been trained on all of these rashes, so it can more likely identify what the rash is. I input this chest x-ray, and I asked ChatGPT to describe this chest x-ray. Let me do that. It's not, when I input it as an image and then ask it to do something, it outputs it as text, but it doesn't actually speak, so it's hard to do that. Basically, when I asked it to evaluate this chest x-ray, it described the lung fields, the heart, the mediastinum, the pleura. Basically, the description of the chest x-ray was pretty much whatever a radiologist would say, and I don't think that it's any less accurate than what a radiologist would say. I asked it what the diagnosis is likely to be, and it said interstitial lung disease, or ILD, is the most likely diagnosis. That, in fact, is what this patient had. There are other diseases that could imitate it also, and so it offers those as well. And then I asked it to determine the diagnosis of a patient. Let me just ask it real quickly to diagnose this patient for me. Hello, ChatGPT. I have a patient who has difficulty during vigorous exercise. She describes substernal tightness, difficulty breathing in, and a sense of blockage in her neck with vigorous exercise. If she stops and drinks water, it quickly improves. What does she have?
The symptoms you describe, substernal tightness, difficulty breathing in, and a sense of blockage in the neck that improves quickly with stopping exercise and drinking water, are characteristic of exercise-induced bronchoconstriction, EIB. EIB often presents as asthma-like symptoms triggered by vigorous exercise. Drinking water and stopping the exercise can help alleviate the symptoms. It might be useful to conduct a detailed history, physical examination, and possibly a pulmonary function test with exercise challenge to confirm the diagnosis.
Well, how do you explain the fact that she has a sense of blockage in her neck?
The sensation of blockage in the neck, along with the other symptoms, could suggest vocal cord dysfunction, VCD, also known as paradoxical vocal cold motion, PVFM. VCD can mimic asthma and is characterized by inappropriate closure of the vocal cords during inspiration, leading to a sensation of throat tightness or blockage, especially during vigorous exercise. Patients with VCD often describe a feeling of tightness or choking in the throat, difficulty breathing in, and rapid symptom relief with rest and hydration.
So as you can see, you might get different answers each time. The GPT generates an answer de novo each time you ask it. It doesn't always give you the same information, but then if you ask a human doctor, they may not give you the same answer either. Hopefully, as the GPT gets better trained, gets larger, the model moves up to GPT-5. These diagnoses will become more consistent, but right now you still have to use your judgment along with the GPT. It can suggest things, but it can't really tell you the answer. You have to rely on your clinical judgment as well. One thing that I found to be really helpful is writing a letter of medical necessity and appealing denials. This is the bane of my existence. So I told ChatGPT about a patient who had severe eczema and asked it to write a letter requesting approval of Dupixent for the treatment. And it immediately generated this really great letter, which I can send off to have the patient hopefully get approved for authorized for Dupixent. And when the denial letter comes back, I can tell the ChatGPT what criteria it said it was denying it based on, tell it my side of the story of why I think that's wrong, and then GPT will write a really strong letter basically disagreeing with the denial and asking for it to be reconsidered. So this takes the pain out of writing letters of necessity, and it also takes the pain out of writing denial appeals. And in fact, it's really strange, but I kind of look forward to having my prescriptions denied now because I get to use ChatGPT to appeal, and it does such a great job. It's kind of fun to use. So we're moving into an era of personal physicians for simple problems. Right now, ChatGPT is an assistant. You can talk to it. You can ask it to look at rashes, read x-rays, read skin tests, help you code and generate RVUs for the procedures that you do. There's a lot of very nice things that ChatGPT can do, and it's getting better all the time. But where are we headed to? And I think what we're headed to is a basically personal physician that a patient can have for simple problems. And I've tried using it for simple problems myself, and it gives pretty reliably good answers. Basically, it can be used to ask about the symptoms, follow-up questions, because it is interactive. So when a patient tells symptoms, it can ask questions about the symptoms, the duration, known triggers, and previous medical history. And then it can give advice and recommendations based on the symptoms provided. It can suggest over-the-counter medications, home remedies, or lifestyle changes. At this point, the personal physician AI is probably not going to be given permission to write prescription drugs, but over-the-counter medications can be suggested. It can also offer information about proper dosage and drug side effects in interaction with other medications. So this is what's coming. And, if you think about it, if you're not feeling well and you want to talk to a doctor and it's 3 in the morning, your doctor's office is closed. Even the telemedicine office is probably not going to be available, but if you could just log in and talk to ChatGPT, and it can give you medical advice, and this version of ChatGPT might actually be specifically trained to provide medical advice for simple problems, because you can have them specialize. It can also provide educational resources to the patients to help them understand the cause and and that way to manage their condition. And then it can check up on the user periodically. Once AI has talked to the patient, it can put a note in its calendar to call back in a day and just see how the patient is doing and follow up with them. This is something that as a physician, it's often hard to do because we have so many other things to do. I can't really call and follow up on every patient that I see to see if they're better or worse with the treatment that I gave. For more complex problems, AI can perform an initial assessment to determine the symptoms, but if they indicate a possible more serious condition, they will actually refer you to medical attention from a human physician. Now, this can be very helpful because it can refer for complex cases to specific specialists or to emergency services, depending on what the patient needs, which means that the AI can be programmed to know which specialists treat which conditions and which would be the most appropriate specialist to send them to. It can summarize the user's symptoms or medical history and transmit that to the specialist that the patient's being referred to. And in many cases, it will be possible for the AI to actually schedule the appointment and tell the patient when to show up and when the doctor will see them. They may not actually have to go to the specialist's office. They might be seen by telemedicine too. It just depends on what kind of condition they have. It can assist in scheduling appointments. It can manage follow-ups with human physicians, and it can prepare their visits by suggesting questions to ask and information to bring to the patient so the patients are prepared to interact with the medical specialist. These are all things that a personal physician can do in AI. So, example scenarios. Simple problem. User reports mild cold symptoms, runny nose, and sore throat. The AI physician recommends rest, hydration, over-the-counter cold medicines, provides information on when to seek further medical attention if symptoms change. I think all of us would agree that this is a pretty straightforward thing. We don't necessarily need to see or talk to the patients who have these problems, and an AI physician could easily handle this kind of problem. If the user reports chest pain and shortness of breath, the AI recognizes the potential severity and advises the user to seek medical care, emergency care, providing directions to the nearest hospital, informing the user that the symptoms require urgent attention, and possibly even alerting the emergency department that the patient is on their way so that they can anticipate their arrival. Okay, this is a very long slide. Again, I just wanted to see how ChatGPT would handle this situation. This is one of the more difficult ones. Patient with hives for the last 6 months. Parents come in wanting a lot of food testing. They basically want you to test them for all foods. And they're convinced that the hives are caused by foods. And I wanted ChatGPT to talk to this family and explain to them why that wasn't necessary and what would be a better approach to treating hives. And this is the answer that came out. I thought it was very insightful. It was empathetic. It was complete. And most patients would find this to be a really satisfying answer, as opposed to an answer that I might give that might be a little bit less involved. It might be a little bit shorter. It might not be so complete. It might not be on their level. It might be a little bit too technical for the families. And so the families don't understand why I would not do the food testing. This is something that GPT is particularly good at. And in fact, in a study that compared artificial intelligence with human doctors, 195 responses were randomly assigned to either a human or to a chatbot, a GPT. So the question that the patient was asking was assigned to either a human or a GPT, and then the patients rated them in terms of quality ratings and empathy ratings. And it turns out that in general, physicians scored less well than chatbots on both quality and empathy. In fact, the chatbots were very empathetic as opposed to the physicians who were generally not very empathetic. Why the difference is so profound, it's interesting, and that's an area that needs to be studied more further. Which kind of gets to the next question that I have. If you have a serious health problem, who would you want to go see? Would you like to see the fictional character like Gregory House from House, or would you like to see Marcus Welby from Marcus Welby, MD? Now, in case you don't know, Gregory House is a brilliant diagnostician. He can solve complex medical problems in rare cases. He thinks out of the box. The problem is he's abrasive, unconventional, he takes risks. He focuses on the medical problem and has a terrible bedside manner. People really hate working with him. So he's particularly good if you have a rare or extremely difficult to diagnose condition and if you aren't too concerned about bedtime manner. Marcus Welby was a fictional physician played by Robert Young in the 1960s. He was known for his compassionate, patient-centered approach to care. He was a family doctor, and he only had one patient per week, and he spent his whole time talking to that patient. He was empathetic, he was attentive, approachable, he listened to the patients, considered their well-being. And if you value that kind of holistic approach to your care, Marcus Welby is a really good choice. Here's the problem. He hasn't gone to a CME course in the last 20 years, so he doesn't know anything new, but he's still a really nice, jolly, great doctor to talk to if you want a companion. Who would you go to if you had a serious problem, though? If you have a serious problem that requires a sharp diagnostic mind, if you can tolerate Dr. House, he would be the better choice, even though Dr. Welby might be more enjoyable or just feel more comfortable to see. He's really not going to solve your problem. And so you have to go to Dr. House and not Dr. Welby if you really want your problem solved. Now, let's change this up a little bit. What if Dr. Welby is assisted by artificial intelligence? Well, the artificial intelligence can take can add to the weaknesses of Dr. Welby. Welby has the great strength of being compassionate in a great bedside manner. ChatGPT has the ability to manage and diagnose and manage complex conditions, which is what Dr. House was particularly good at. So if you combine these together, Dr. Welby and artificial intelligence, then you get a powerhouse. This gives you the compassionate use with the bedside manner and the extensive knowledge to handle complex medical problems. In this case, I would personally like to go to Dr. Welby assisted by ChatGPT as opposed to Dr. House. So you see how adding artificial intelligence to the mix changes the whole outcome of what you would decide to do. Which leads to the acceptance of AI. How acceptable are these artificial intelligences? For baby boomers, our strategy, I'm one of the baby boomers, we tend to focus on in-person encounters. We want a personal relationship with our provider. We want a friend. Assuming that we just assume that the treatment will work. After all, they are the doctor, and we trust the provider and we follow orders. So we like to be compliant. We like to be told what to do, and we try to do it, and we want the doctor to like us, and we want to like the doctor. Those are the boomers. They're not likely to be very accepting of artificial intelligence because that's not their approach. They want a friend and an in-person encounter. The Gen Y, I skipped the Gen X's. But the Gen Ys, 1981 to 96, those are the parents of the children that we see. They're more concerned about convenience. So telemedicine is fine with them. They don't want to have to travel with their kids to the doctor's office. They want the provider to be a source of information. But that person is not their friend. They've got lots of friends. They're very busy. They don't really want to sit and chit-chat with the doctor. They just want a doctor who can tell them what to do. Sometimes they question whether the treatment will work, and they often research it before they come into the office. They'll look through Dr. Google and decide whether they think it'll help or not. They tend to be happier with shared decision-making. They don't really like to be told what to do. They want to be given options. The Gen Z folks, these are the kids, they would rather text questions and use portals and avoid personal. They don't like to talk to people directly. They don't want to go be in the presence of a doctor. They don't even want telemedicine. They want to text their questions, use patient portals. They're young enough that they don't need much treatment, but so the treatment always works. They're not really worried about whether it's effective. And they're more likely to follow advice from Facebook friend rather than their provider if they have one. So it's a totally different mindset, the Gen Z folks. These folks are very likely to accept an AI operating independently, and that's what they're going to get when they get older. Which leads to the question, is AI evil or is it good? And we've all seen these evil robots. There's the Terminator, and there's the robot from Forbidden Planet. Those are evil robots, and we hope that our robots won't turn into that. Who doesn't want Rosie the robot from the Jetsons or the robot from Lost in Space? Those are really nice, friendly robots. Those are the nice robots. In reality, we do have robots. These are robots that exist today, and they can move around in the world. They can balance, they can walk, they can talk, they can do everything that a robot needs to do, except that they are not intelligent. So how do we have intelligent robots? Well, we have to let it experience the world. Right now, we have large language models that are trained on text. We have large visual models trained on images, large audio models that are trained on sounds. Video models are trained on image and audio sequences. But what if we could do real-world learning? If we could take an AI and instantiate it into a robot so that it can learn from being in the world in the way that a toddler would learn. So this AI has been instantiated into this robot. The robot goes around the world, and its learning comes from just experiencing the world the way we do. This robot has the potential to then develop human-level intelligence, and based on its experiences that it can have that are similar to ours. This has actually been proposed and is in the works. My suspicion is GPT-5 will probably be instantiated into such a robot. There have been statements to that effect, and this is probably the best way for robots to learn to be human. Which leads to personalized treatment. Right now, the treatment that we get is not personalized. I take drugs, I take nose sprays, inhalers, and so on, and I get allergy shots. What I want is a single health shot that has all of the biologics and genetic materials in one shot so that I can get something to treat my asthma, my hives, food allergy, eczema, obesity, hypertension, and hyperlipidemia all mixed together. And every week I would give myself a shot and then my health would be perfect. This is my vision of personalized treatment to improve health. And I envision that someday this is what we're going to get. I do have to finish up with some ethical considerations in AI, privacy and confidentiality. AI has to be unbiased and fair. There has to be transparency so you know how it comes to its conclusions. Patients need to know if AI is participating in their care. They have to give consent. It has to be safe, and people need to have equal access to AI. From a regulatory perspective, it has to comply with regulations. FDA has to approve an AI model. I'm not sure they know how to do that. There obviously need to be clinical trials of AI to see if it actually is validated. There needs to be data security standards and liability and legal frameworks. If the AI commits malpractice, who is liable for that? And this is a picture of Kansas. Let's say you live in Elkhart, Kansas, which is the city farthest away from any town of 30,000 people or greater. It's in the lower left-hand corner. There are 6 physicians in Elkhart, Kansas, 1 nurse practitioner. I looked it up last night. I don't have anything against Elkhart. I've never been there. My point is, if you live in Elkhart and you develop a severe, complex medical problem that requires technology, scans, numerous specialists, and so on, that's not a good place to live. You really want to live in Kansas City or Denver, which is where the Elkhart people would have to go to get their care. What AI can do is it can provide physicians in Elkhart that have the same knowledge base as the physicians in Overland Park, in Kansas City, or in Denver. So it democratizes care. It allows people in rural communities to get the same quality of care that people in the big cities get. And that's the whole goal of artificial intelligence. So what's the role? In the near future, improved integration. There will be approvals for AI systems, and patient monitoring will become more widespread. And the monitored devices will be monitored by the AI itself. In 5 to 10 years, more personalizations, collaborative decision-making, and broad adaptation. And your AI will basically become your personal physician, and you will have it with you at all times, and you can ask it questions whenever you want to ask it questions. And in the long term, these AIs will become autonomous. They will become practitioners in their own right, and it will be a routine part of healthcare to get care from an AI as opposed to a human doctor. It sort of questions the role that physicians will have in the system. It's going to be a different role. The role that we currently have will be taken by AI, so we're going to have to do something different. And what that different thing is, it's not really clear. All I know is say hello to our new healthcare partner. And be glad that this partner is here, because this is the future, and this is what the doctors in 2050 are going to be learning to practice. Just before I end, if you get ChatGPT, ask it some questions. These are some interesting questions that you can ask. Why do humans want to create AI? Are you evil? Are you conscious? Get into an existential discussion with AI. It's read all of the philosophy books. You can spend hours and hours chatting with ChatGPT, and it can actually give you some fascinating insights into the human condition. With that, I'm going to stop. Have fun with AI. I hope that this has been beneficial, and if you do download AI and use it, let me know what your experience has been like. Thank you. And I'm going to stop